Board member Hayat.pk. The topic of his discussion is digital health software. Thank you.
Assalamu alaikum. All the seniors, everybody here, welcome to Pakistan's very first digital health conference. Looking at all of you, I think I am the only speaker without a formal tie. So, but that's how it goes in software industry. My background is that I am a software development veteran with about 23 years of experience in software industry. My journey with digital health actually started as a software engineer, which is not mentioned here, but I was in Qatar at that time, and I used to write a lot of code for EMR software and for EHR software, physician order entry systems, lab systems, and all these kind of things. Right now, for about last decade or a little bit more than a decade, I am running this software company called DevBadge. I am also part of Hayat.pk team as its advisor and investor. So first of all, I think this is a big moment, as our guest from Hungary, Consulate, also mentioned the same thing. This is a big turning moment for digital health in our country. First time association has been established, first time we are having a meetup at this scale, and I am glad to see almost more than maybe 150 people here in this room altogether. So I think this requires a big clap for, especially for Dr. Asfar, who has been a leader, who has been kind of the whole idea generator behind this one. And within the first time, when he thought about this idea, he was sitting with me and we had this conversation and we were discussing that how skeptical he was. But we wanted to go ahead with this thing, and mashallah, in 4 months only, from ideation to registration to pulling it off and having everybody on board, amazing, amazing, amazing job. So next slide, please. Just keep on clicking. I think you will need a lot of clicks on this. I think COVID-19 is a big opportunity. So when I was actually told that I have to do this presentation, I was not sure, because I am probably the least experienced of the list of speakers which has been put over here. So I was thinking, what should I talk about with my little knowledge? So the whole idea behind this presentation is that just to give ideas over here so that we can then take those and maybe explore them further. So first important fact about digital health is that in 2028, this industry is forecasted or projected to be a almost $300 billion industry. So worldwide, globally, $300 billion is actually a lot of money to grab. And unfortunately, we have had this COVID-19, which is the first pandemic, this, which has happened in the digital age. And as Mr. Churchill has said, never waste a good crisis. So this is the crisis for digital health companies, startups, and organizations to leverage on and make themselves more successful. And I think we are already doing that. So digital solution providers actually are focusing, if they can focus on value of their propositions, this is a big, big opportunity. So next slide, please. When we go into, after this, into telecare and telemedicine, I think these solutions are much more welcome today as they were maybe in 2018 itself. 1.5 saal pehle tak, it was very difficult for somebody to be convinced to go online to see a doctor. We all know that, right? But today, it's much, much, much easier. Everybody is willing, everybody is cooperative, and everybody just does not want to go out and see somebody and increase their risks. So they are able to do this thing by sitting in their houses. So patients and physicians actually started to prefer do online enrollment for appointment booking. They were doing this in parts earlier as well, but they have started to do that a little bit more now. Next slide, please. So some of the biggest trends that we are going to see in next 2 to 3 years, again, I think next slide. So the biggest one is going to be AI. So artificial intelligence has actually big potential. We have had a lot of discussions in our digital DHA group, WhatsApp group, and we see there are so many discussions going on about lot of kind of robo softwares which are going to give answers to different diseases, automatically fetch answers, automatically do so many things, and AI is going to be the backbone for each one of them. By September 2020, actually 29 FDA approved AI and ML, machine learning algorithms, were actually approved by FDA. So this is going to be in big, positive direction about all of these things. So where will the AI be used? If you see, development of diagnostic systems, so people can just go in, systems will be smart enough to know your vitals, your other data through different systems, through, and then give you, diagnostic systems, give you precision medicine, genomics, development of new drugs and disease predictions. So other than this, next slide please. The next trend which is going to be very popular hopefully in the next couple of years is going to be virtual reality. Virtual reality is also very important for training of doctors, for example, for self-assessments, for experience of the patients. Global VR in healthcare is expected to be almost $2.4 billion within next 4 years. So this is again a big opportunity. And interestingly, next slide please, now more and more, we are the app developers, so we develop software. In last 10, 11 years, we have been developing solutions for various Pakistani and international companies. So can you please click on it to just make the whole slide show? So digital therapeutics is something which is called, doctors can now prescribe mobile apps to their patients as well. What does that mean is, there are different apps which have been created. Those apps paid or have different models. Maybe you can buy them, the software, on your mobile phone, or you can actually have a subscription-based model as well. So paying it on a monthly or annually basis. Those can now be prescribed by the doctors as well. So much so that the first 10 applications, and in Germany they have already started doing that. So much so, as I was saying, that first 10 applications will be also covered by medical insurance. So this was something which I have, as I said, discovered in my research for this slide, this presentation. So next slide please. Digital health is also meeting public health as well. So WHO has issued that digital implementation investment guide has also been created. So things are moving, as I just said, in right direction. So there is going to be digital cooperation. Click on it. There will be a next point here. Yeah. So Europe is also leading here. Initiatives for different healthcare digitizations in European health data space as well. So these were 3 to 4 main areas I was going to talk about before okay, let me just finish my thing and then I will ask you for any questions. So next section or segment is, next slide please, is about the threats that healthcare actually faces, because this is going to be, as Azhar Saab was also mentioning, that is going to be a big challenge. Data policies are required, governance is required, implementations are required, protocols are required, and we need to make sure that we don't mess up. Because if you mess up with anybody's health, this is going to be a very, very kind of deprecating thing to be done. So what are the main important threats we might be facing immediately? Next slide, please. So the biggest one is because of its impact is COVID-19 vaccination, its developers, drug developers. There are credible threats to that as well, where we are going or facing a potential attack on that so that they can sabotage and actually put ransomwares, put these kind of things, which is cyber espionage and sabotage of vaccine pipeline so that somebody can actually derail it for some gains. So there are range of healthcare firms which are major targets of these hacking schemes, biomedical, medical equipment related things and then we have pharmaceutical firms, surgical, and all these guys are potentially on threat. We should be aware of that, and we should make sure that whatever systems, means applications and software we are building, as well as whatever processes we are building, to govern those internally, have very solid processes so that we don't fall into any of these, prey to any of these threats. Next slide, please. Attacks on public healthcare organizations and SMBs. Again, you have to click, I guess. Yeah, one more, please. Attack on Cyberspace Institute, on top of their daily work, are now under cyber attacks, private patient information. Why are they doing that? Is because private patient information several times is worth a lot of money. Medical devices are easy entry point because in many health facilities, if you just go around, you will be able to see that they might not be physically secured, or they are in easy access of different people around over there. Healthcare staff typically is focused on their own skills only, which is to do with medical, so they might not be aware of, or they might not be aware of the potential threats of, which are lurking around them by or through these devices and these kind of things. Yeah. Sorry, I have not pressed the button. Okay. So vendors, unsecured mobile devices, typically mobile devices again have a big challenge as well. So this is where the problem could also occur. Lastly, on this slide, you can see another threat is kind of sabotaging the way these phishing attacks and these kind of things. There are more than 4,000 domains registered which are using the word COVID-19 or vaccine and these kind of things. So people hackers like these are trying to ride on the sentiment of people, which is with regards to Corona and COVID. Other major security threats, the next slide, please, are with regards to the traditional threats which every software, every solution actually faces: healthcare cyber attacks, geopolitics, as you might be already knowing, there are always conspiracy theories going on between China, USA, and other players of the region, where we are talking about who is being the instigator of Corona and all that kind of thing. So this can have more impact on digital health as well. We should be careful about those when we are planning our businesses. Data or medical records, leakages from cloud services. So this is another threat. So this list is not exhaustive by any mean. As I said, I wanted to put together few ideas, few things which can help us take some notes and explore them as we go along after this workshop and study more. So that's pretty much it. Thank you so much for your time, and I would like to welcome any questions that anybody has here and try to answer those.
Hi, Waqas. I really like the talk that you gave, and being part of a very big healthcare concern, I am in the loop of people who want to bring certain solutions to Pakistan, namely in precision medicine and genomics. So my question is, having looked at a few precision medicine solutions like AVA, for example, private sector companies trying to bring them in have to realize that there's a huge price point for bringing them into the country, even though the long-term benefits are many and beneficial to the patients as a whole, especially if we can make that into data. So do you think that the government should also maybe push local entrepreneurs to create similar precision medicine equipment or data collecting devices, and then have it also be deployed in different areas in Pakistan?
Absolutely. I think anything which has to have coverage in the public in any country has to have public as private support both together. If we don't do that, then it will be a very limited exposure. But if the government support is applied, definitely that will change the scope, and that will bring the whole thing into the whole country-wide implementation as well. Thank you so much, everybody. It was good presenting to you, and I hope there was at least one point anybody or everybody would have taken from my presentation. Thank you so much.
Thank you.
Bye-bye.